All right, good evening, everyone. I want to thank you all for your patience in waiting here. We were hoping a few more students would trickle in for this presentation. But again, it will be recorded, so students will hopefully have the chance to watch this on their own time and ask questions via the live stream, but then additionally, feel free to reach out to us on all of our social media channels. So a quick introduction, my name is Jackson Dengermont, and I am the USGD president, and I'll be giving probably a brief, like 10 to 15 minute presentation on the ASU student health fee, which of course we're looking at a proposed increase to said student health fee. And if in the meantime you do have any questions, I would ask that you save them towards the end of the presentation, but if there's anything pertinent to the slide that's on the screen, hopefully there are no questions on this slide since it is pretty self-explanatory. So away we go. So to give you more context and background on the health and wellness fee, so the health and wellness fee covers about 1/3 of the operating costs needed to run ASU health and counseling services. The remainder of the cost is covered by you as the patient through copays or pulling your insurance. So why was the fee implemented in the first place? The fee originates back to 2009 when the Council of Presidents is made up of all the student body presidents in ASASU. And they had desires to provide a steady and predictable income source to allow for enhanced services for students who seek both preventative care, mainly maintaining health center operating hours to meet the student demand of a growing population, decrease wait time for students with minor injuries or illness, and enhance outreach and wellness education services. So at the time of implementation of this fee, we saw this in terms of the usages per campus of our health services. The reason why there was no data applicable to downtown is because while we were a campus that was starting to form, we had no health service center at the time. So since the fee was implemented in 2009, there has been work done by the Associated Students of Arizona State University, of which all of the branches of USG and GDSA. So this semester, first semester of this year, ASASU really concentrated on expanding health services to the best of our ability without expanding the fee. So things that we were able to do prior to the expansion of the fee would be an expansion of services, including acupuncture, chiropractic appointments, and masseuses at all of the campuses. A flat rate STI testing for those without insurance or choose not to bill insurance, increased staff, including a psychologist on each campus, and increased hours at both counseling services and health services to meet the rising demand of appointments of our student body. Wellness vending machines on the Polytechnic and West campuses we're really excited about because we are, I believe, one of 2 universities nationwide to partner with CVS to provide those resources. The reason why Polytechnic and West were selected in downtown wasn't due to the proximity of the resources they have relative to their own campus, because we are in a city, we technically are a light rail trip away from a CVS and then a shuttle stop away from Safeway, where a majority of these items could be provided. But if the pilot tests go well on Polytechnic and West, we hope to expand those services to all of our campuses, giving students 24/7 access to this product. And additionally, the implementation of Tau Connect, which is the acronym for Therapy Assisted Online, which is essentially a self-help tool where students can seek guided practice and instructions on how to meditate, how to do stress relief management, and schedule appointments with counselors and psychologists on ASU's campuses, but then additionally learn more about behavioral health resources within the surrounding community. This is the new schedule of the massages, the chiropractic care, and acupuncture for all locations. At the top, you can see down downtown. So we now have massage appointments available Monday and Tuesday, chiropractic care available on Wednesdays, and then acupuncture. We're still working on steadily expanding, but as for right now, it is downtown on the last Thursday. So since the health fee, a number of things have happened. Enrollment has gone up at the institution. That's number one. Enrollment has gone up. Two, both nationally and at ASU, medical costs have risen. From that, there's an increased demand on the services that we have offered at our institution. So as you can see, on average, we were servicing around 47,000 students in fiscal year 2009, and at fiscal year 2017, we're projected, and this is right around the outcome of around servicing 63,000 students within health services, which is about a percent change of 32%. The important thing to keep in mind of that is due to increased enrollment, but then additionally increased demand, which is outpacing actual enrollment growth. There's a strain on revenue and available resources for those services. More so on counseling, it's even more extreme since the fee implementation. We've seen a rapid amount of improvements given to counseling services. So back in fiscal year 2009, only around 11,000 students comparatively to fiscal year 2017, 24,000 students utilizing the counseling services, which is a percent change of 109%. And for being an institution as large as ASU, the fact that there is no wait time in any of our counseling centers is something to be extremely proud of as an institution who values the holistic health of all students. Some further context, this is how the appointments have increased since fiscal year 13 and the projected outcome of appointments for counseling services, specifically the downtown campus. So on average, we're expecting to see 3,382 individual appointments at the downtown campus this year, which has gone up significantly from fiscal year 13. Additionally, this provides further context of how many individual appointments we're seeing per year at health services downtown. And the reason why I'm including this is because of the following graph, that as the demand on the service has been increasing since fiscal year 13 in the case of downtown, the percentage of health service funding from the health fee has equivocally gone down as well. Meaning that due to increased demand on available resources, the percentage of revenue that the health fee actually provides for health services and counseling services to function has gone down, meaning that, back to the original slide, only about 1/3 of the overall operating cost is actually subsidized by the health fee. So from all of this and being cognizant of a lot of demand and strain on our available resources, the Council of Presidents had conversations with several members of the administration who work to oversee health services and counseling services. And the action items we wanted to put forth to minimize, or to address the demand, but then additionally expand the services are the following: extended hours for weekday hours or add weekend hours on all campuses. That's extremely weird wording that I didn't catch, so I apologize for that. Increase specialized care on all campuses, which can include the following: sports medicine, women's health, nutritionists, with an additionally the other specialized care that we've already added, such as the massage appointments, the chiropractic care, and the acupuncture. The continued implementation of telehealth and online self-help intervention tools. For those of you that may not know, the easiest, explanation of telehealth, without going into too much detail, that would essentially allow you to Skype in to your doctor. This is especially helpful around cold and flu season, when the demand on health services is extremely high. And the reality is we just want the students to stay in dorms, to stay healthy, because in those certain circumstances, there really isn't much the providers can provide in terms of an actual treatment plan, just besides a lot of rest and sleep and fluids. So in order to prevent the spread of germs, but then additionally decrease the wait time on the peak season, the implementation of telehealth, both in the primary and acute care settings, and additionally more online online self-help intervention tools to the point where we would allow students to Skype in essentially to counseling appointments within their own dorm to talk to someone live in times of crisis if need be. Additionally, being mindful of the cost of behavioral health within our community, making sure that patient advocates are prioritizing low-cost referrals for behavioral health in the area. While ASU's made the commitment to offer $15 sessions for all counseling services, no matter if it's your initial or a follow-up appointment, you still have to be cognizant of how expensive behavioral health is in the community, and making sure that they're doing their part to honor the, I guess, reality that most of us are college students and cannot afford to pay $120 per counseling session if we need long-term care. Just making sure that they're prioritizing the low-cost behavioral health referrals within our community. This is the last point is something that I worked on throughout this year is enhanced online patient portal for scheduling appointments, access to medical records, and communication with all providers. Two facets. One, we are an incredibly diverse institution, and at the time last year, there were only 2 languages offered on our patient portal, English and Spanish. We have now made the switch to add Mandarin Chinese, Cantonese, which is a dialect of Chinese, and Japanese as well. And we're working on adding more languages as NextGen, which is the patient portal system we contract through, allows us to. But additionally, better patient portals make patient care better for everyone because it means more time with providers, but then additionally, it means easier access for students to get information they need and want on a 24/7 cycle without the need of calling their provider and going through all of that. So this graph demonstrates the already low cost, subjective. Comparatively, ASU is the second lowest behind Utah as it stands for the health fee that we bill our students. At $40 right now, it would still put us to be the second lowest if this increase was pushed through. As you can see, USC and Stanford are quite expensive, but then additionally, their models are rapidly different than our institution. But a few other notes on this slide. USC also has mandatory student health insurance, which is $1,200 per semester, which ASU does not require. And there are other factors on this as well. I can come back to this, but that's just to give you a general context of where we as an institution sit compared to the rest of the Pac-12, but then additionally schools that share a similar size of enrollment as ASU, so being Texas A&M, Florida International, and Central. Academic performance of users who utilize health services is higher on average than the ASU average, so this is just a quick statistic on it. And that's it. That was a lot of information, so I'm sure there's probably a question. For that, I'll add here with that. Any comments, concern? Yes, sir.
I came in late. Appreciate you touching this in the beginning. With this increase, will this increase take immediate effect for this next term?
Yes.
Yes or no?
Yes. Mr. Arrow.
Jack, first of all, I want to say you've done a really great job this last semester fighting for students. I think a lot of the things that we've added, especially that patient portal, the extended hours, I think those have been extremely helpful, and not just to our downtown community, but a lot of our communities that work during the day and can't get to a 9 to 5 appointment. So I think you've made this a much more inclusive program. I did feel it's necessary to ask some questions, and it's completely okay if you don't have any of these answers. Right now, these are pretty detailed questions, but do you know how much revenue this fee is going to create?
$2.1 million.
$2.1 million. And then do you have a breakdown of where the money's going to go?
Not the specifics. Priority as extended hours for the clinics. Big thing with that is both the 2 points require increased in staffing to provide for those extended hours, but then additionally in specialty cares. So a percentage of the funds would be going, of the revenue rather, would be going to pay for the not pay for the salaries, but help subsidize the cost of those new graduates. Yeah, right. But then additionally, the implementation of telehealth and other contractual services cost money.
Right, yeah, right. And will there be like a detailed breakdown of how much is going to each one of the programs?
We can get that information for you.
Great. And then because it seems like a lot of this, with the increase in students that are attending counseling, if we do have a gap, will that mean that the fee will drop? That'd be kind of like a one-time expenditure.
What do you mean by that question? Sorry.
So it seems like a lot of the reason for the increase in this fee is because so many more students are using counseling services. Is that an accurate statement?
There's a second part of your question. Can you ask that?
Oh, okay, yeah. So it's because of the increase in students using this program, if that number drops, that means the fee will drop as well.
No. So is your question if the number of students who utilize our counseling resources drop, would the fee increase or the $15 fee drop?
The additional $15 fee drop.
No. But then additionally, from the both enrollment trend that we're seeing and the usages of our counseling services, we're predicting a projected increase in counseling services across the board. So we don't see that happening. We actually see the demand expanding on our services as students become more cognizant of their mental health and take the steps to not only better themselves, but get the help that they need.
Oh, yeah. No, it seems like we are on an increase.
But I understand your question.
But do you think then that you can negotiate some kind of deal with administration and that deal should drop the fee increase should that service not be as utilized?
Again, based on the data that we're seeing, we don't project that happening.
So one thing that generally happens out of an increase is students, they react negatively to it. How do either the university administration or USGD plan on promoting the additional services to possibly mitigate negative reactions?
Right, and that's, oh no, my slide went away. That's been something the Council of Presidents, both last year and this year, prioritized with the administration is how do we effectively market all of the services to our students. Counseling, we see and we commonly hear that students are aware that it's $15 per session, but when it comes to the languages used on the health services website and the counseling services website, something that we really wanted to communicate to our students is that your financial situation should never be something inhibiting you from getting the care that you need. And committing to expanding that marketing across the campus as well. I think USGD can have a really active role in promoting those services, but then additionally, it's really working with the administration to ensure that the marketing for these services just isn't limited to offices that students may not be visiting, but can be seen across campus as well, and can be found, for example, on my ASC, which those preliminary conversations happen. Additionally, connecting the students to resources, this is a little bit tangential, will become even easier in the fall 2018 as we're currently in development of an app that would allow students to pretty much see everything at the university for initially.
If the fee were to be implemented, do you plan on explicitly notifying the students of ASU that the fee is being increased, or is it just going to go without saying next time they pay, they don't know whether or not it's going to?
As an administration who believes in transparency, we would be notifying students to the best of our ability. Any other questions? Yes, sir.
So the reason I'm bringing up these questions is because I know there's a lot of students that aren't in this.
Right, and I think
so I'm not trying to be like hounding you or anything. So I So it's just no, I'm doing this out of their sake, because I feel like for a lot of these students, every dollar matters. We've been told a lot of times, this is just another $30 a year, this is just another $100 a year, and those start to add up. And students start not being able to afford them. My roommate from freshman year had heard that. Students who I was friends with over the course of being here have had to drop out of the class, and so I feel like it's important to bring up some of these points on being fiscally responsible. And so I know last year on April 28th, former Director of Finance Vanessa Bird reported that USG downtown finished with a surplus of $42,000. Going back to 2015, Victor Wren reported in state press that before the increase in the student programming fee, that there was a surplus across all USGs of $136,850. Has USG considered putting any of their own budget money into this to help decrease funding or decrease the fee on students?
So the fee specifically, student programming fee, which I believe you're referencing, is specific towards the subsidization of programming, the programming budgets for USG, PAB, and other activities on campus, which is the purpose of that specific fee, whereas the health fee is specifically for this fee to generated revenue. There are other ways that the university can reinvest revenue produced by tuition, but fees are specifically mandated for the cause that they were able to.
Right. Yeah. So would USG then consider reducing their own programming fee? That way the increase net total on students would be less?
Reducing the programming fee would reduce the scope of an organization. The two aren't necessarily linked to a certain degree. The reason why I say that is we necessarily don't have the freedom to do that from a university planning perspective, but this conversation is solely about the health fee increase, not about the student programming fee. That we can have those discussions if students feel that the student programming fee is too high, but solely for the purpose of this conversation is geared toward the health fee. But then additionally, related to costs versus, actually the conversation price versus cost, which is something I don't necessarily want to get into. So you and I can have a conversation one-on-one basis. Yeah, keep in mind, this hasn't been finalized yet. We're still very active in our search for feedback across the student body. So in no ways is this finalized by any means. We'll still be collecting feedback through the next week. And if you have any questions, comments, or concerns, my business cards are out there, and I can hang out for the next few hours just in case students trickle in. Yes?
What is it looking like, to your knowledge, is the fee will be going up?
It's not determined yet. We'll take a look. We had a really good feedback collecting day yesterday, and we haven't had a chance to upload all of that because, believe it or not, we actually use paper to collect the majority of our feedback. So I have to go through and sort all of that, which will be one of my projects for tonight. I look forward to it.
So how was the number $15? Like, how did that come about?
Yeah.
Did COP calculate how much money would need to go into be able to pay for all of that?
Yeah, so it was a conversation had between COP and an individual named by Dr. Aaron Krasnow, who's the VP of Health and Counseling Services. We gave him our goals that we wanted to see within these services, and we gave essentially a number range of what a $15 to $50 increase would look like at times, and then from there worked our way down to ensure that we were getting essentially the best bang for our buck in an increase. And thankfully, the revenue produced by a minimal amount, which is $15, is enough to meet all of our goals for the time. Does that answer your question?
Yes, but to follow up.
Yeah.
There is, if there were an increase, the minimum would have to be $15. Is that what I heard?
Mm-hmm.
So for there to be any increase on any.
No, sorry. We, in order to meet the minimum amount of our goals, the necessary increase was $15.
Okay.
As you don't believe any of you were here when this happens, it's a fairly young crowd, student-wise. The student programming fee went up by $5 when the increase was passed. It's more of an incremental change based on conversations with the university in terms of the fee setting process. So like there's no set amount that a certain fee can raise based on any preliminary restriction. There are stipulations about what the university can approve without approval of a board. As for it goes for the increase of tuition, on average, you see a 0 to 3% increase on tuition across the university, both in state, out of state, and international.
Implemented, will the health fee be reviewed every 2 years like the athletics fee?
That is a stipulation we're working on. Any other questions? Yes?
So have there been no increases in this fee since it was established
There
in
have not.
2009?
Yeah. Well, I guess with that, I'll stick around for any questions. As always, feel free to contact me at any time. I'm very responsive through Facebook, but initially through email as well. My business cards are on the table. If you haven't had a chance to pick up a shirt yet, please do. And if you have any questions, again, my name is Jackson, and thank you all for being here. I think Ryan's going to say